Hello, everyone. We are very happy to be here as a pediatric regional anesthesia working group in the World Day of Regional Anesthesia and Pain Medicine Day. It's a pleasure. We will be together with John, and we are working together in pediatric regional anesthesia together. And we all talk about the importance of regional anesthesia, especially in children, and about the surgery and about the education. And so we will start with John, and now he will introduce the presentation, and we will talk after that. Thank you. We will see soon.
Thank you very
John,
much.
your
Thank you very
turn.
much, Professor. Thank you very much. It's an important topic actually, because for pediatric regional anesthesia, we start small with small steps, and still the world also is a little bit hesitating about doing regional anesthesia for pediatric patients. So I want to just show some numbers about pediatric surgeries, pains, and the problem of chronic pain. So let me start with the presentation. So we know that there are lots of kids all around the world. If you check for the number from the UNICEF data, it's almost the one quarter of the world population, and we know that there are lots of surgeries performing all around the world. It was 234 million patients in all around the world in 2004, but it grows much higher to much higher numbers to 212. It turned into 312 million patients having surgeries. So the numbers are going up and up, and we still don't know the proportion of pediatric patients in these numbers. So that's the key question for us. There are about 3.9 million pediatric surgical procedures per year. It means that we are talking about many of the cases, not like just only the rare complex cases that we are doing, but also if it talking about everyday procedures like appendectomies, inguinal hernias, limb fractures, circumcisions. And so that is why extra session is important globally, because 4 million children are having surgery. That means 4 million children are at risk of pain actually. And if we don't standardize how we manage that pain, specifically using regional anesthesia, of course, we are failing a huge demographic. And I wish it were that simple, that the only pain is just an ouch moment for every kid, but it's one of the most alarming slides in my presentation, which is about chronic post-surgical pain. The data shows that the incidence of chronic pain after surgery in children is around 11%. And the biggest risk factor is the poorly treated acute postoperative pain. It's a vicious cycle. If you don't treat the acute pain effectively in the recovery room, we are essentially rewriting that child's nervous system actually to be sensitive to pain for months or even years, maybe. And it gets worse for vulnerable groups, let's say, for patients with special needs, actually, the children with cerebral palsy or cognitive impairments. The risk of developing chronic pain can be as high as 50%, not limited to 11%, but to 50%. Precisely, we have to stop viewing pain relief as a luxury. It's a safety measure. Because untreated acute pain leads to chronic pain, and regional anesthesia is our best tool to break that link. And we know that if you don't treat it very well, it's a chain of problems, and it turns into the development of chronic pain, then it turns into the need for additional hospital admissions. It turns into the risk of falling behind in education and also for falling behind in work. And the main problem is the quality of life is impaired, and it ends like it ends with an economic loss of workforce, a loss of quality of life for all of the world, not just for that kid, but also for its family and for all the society. And in the past, or let's say still, the regional anesthesia in kids was seen as plan B, or something you do only if the systemic drugs don't work, or maybe for a very complex case. We need to flip that to plan A. We talk about the plan A, we start talking about the plan A blocks now. The benefits are clear because we can reduce the intraoperative opioid consumption, uh, make it less nausea and vomiting, faster recovery, and happier parents and happier kids. But plan A blocks also refers to simplicity. We aren't asking every anesthesiologist to do complex deep blocks. We are talking about safety focused basic blocks, facial plane blocks, basic plexus blocks, and blocks that are easy to learn and safe to perform. And for an umbilical hernia, let's say, we can do a rectus sheath block, or for a lower abdominal surgery, you can consider doing a TAP block or a QL block, and these should be the standard of care, not the exception. But that we have that the philosophy, the educational philosophy comes in. We call it with the one of our colleagues, the baby blocks call it crawl, walk, run. You don't start by running a marathon, but starting with the basics, understanding the anatomy, mastering the ultrasound physics, and learn the safety checklist actually. Beginning with superficial plane A blocks on older children, maybe, or teenagers or under supervision. Then running is meaning that you then eventually move to more advanced techniques, the catheters, the deep blocks, the blocks for the infants actually. And the goal of the ESRA is to show that we have a curriculum, that we have the tools like virtual reality and simulation to help people crawl, then walk safely before they have to run in a clinical setting. And finally, I want to say that we start doing it step by step. First, we get together to have that working group, the pediatric regional anesthesia working group under the ESRA, the name of ESRA, and that we can say that the new chapter begins for both ESRA and all the world. We start discussing in between us how to improve the resources, the educational resources, the other technical skills for every clinicians all around the world to just perform regional anesthesia for kids safely, to feel them that they can do it properly for kids without any hesitation. So with 9.10 million surgeries a year, every time you choose to perform a regional block, you aren't just numbing a nerve, actually. You are potentially preventing chronic pain and changing that child's relationship with healthcare for the rest of their life. The future is in hands, actually. And literally, with the probe and the needle and the local anesthetic, we can do it properly, starting with the simple blocks, and we can change everything for that individual kid. So this is what I want to show briefly for just to start our conversation together.
Thank you, John. Yes, we are a new working group in pediatric regional anesthesia under ESRA, but we have our work. And first and foremost, we must establish clear objectives for our working group, and our primary aim should be develop and standardize pediatric regional anesthesia practice. We know all these facts, and we are connecting to all pediatric anesthesia societies and working groups again as ESPA, LASRA, and Baby Block, and we are organizing workshops and education programs and research together. What is the aim? We have to focus developing international standards in pediatrics. We have to improve ourselves, and we know that we have very, very difficult and important work about it, and ESRA has this power. We have a lot of people around the world doing exact pediatric regional anesthesia, and we will be together and to educate ourselves and gathering our knowledge and improve the pediatric regional anesthesia in the future. We are waiting for all our colleagues to join us, and it will be improve our working group around ESRA and the other part of the world and the societies. And it will be a good World Day of Regional Anesthesia and Pain Medicine. I like to thank to the ESRA, especially the board and NAULA for improving us and pediatric regional anesthesia. Thank you for today and this podcast. Thank you.
And
Can?
also, I want to talk about just do a reminder. Let's say we have a questionnaire that we are doing with as the pediatric regional anesthesia working group as a starting point to understand where we are standing all around the world. There are some 30 questions I remember like that, asking whether they are the people around the world doing the regional anesthesia, what are the problems that if they are not doing it properly, what can be the possibilities for further educations. Please provide your answers to our questionnaire, that then we can understand what we need altogether, and we can start improving our knowledge for pediatric regional anesthesia. Thank you very much for giving us this opportunity. Thank you.
Thanks.